Hi, this is Dr. Thomas Rocco from CBD Health Podcast. Today's episode is with Debi Wimberly, who is from Effective Cannabis, who today wants to talk about her new newsletter called Effective Cannabis Newsletter. You can get involved on effectivenewsletter.com and sign up for free. What she wants to build is a community of people to talk about cannabis so we can understand how it works and help each other with the evidence and experience of our life. She's a personal health and wellness therapist her goal is to help people as a community. And today she's going to talk about her endeavor again with Effective Cannabis Newsletter. Debi, thanks for taking time out of your busy schedule to speak with me on CBD Health Podcast. Great.
Good morning.
Good morning. Nice to talk to you again, Debi.
Oh, it's wonderful to be back. Thank you for having me back.
No, I think this is great. You sent me your newsletter. This is like what you're trying to do and provide a community for people like we talked to last year, which I think is a great idea. Because again, you like to do personal health and wellness treatment, but the main thing when we spoke is you really want to get this as a community so people can help each other. So this seems to be your first step, this newsletter. I think it's great. I was reading it when you sent it to me.
Yeah, the newsletter is designed for just the average person,
right,
to understand about medical cannabis, because searching the internet is not always our friend when we're looking for quality information and taking care of our health. And we want to make sure that we're providing each reader or each consumer of our newsletter information that will help them make decisions for their own health.
Right. I just the newsletter from January 2023 about chronic pain issues, and I like the way it starts out. Like you started out from the ground level, talking about the endocannabinoid system, and that's where you have to start to really truly understand how it works and why to use it. And you have so many other things. You have blogs and videos and even courses and webinars too. So, I mean, this is what we need. We need to help each other out.
Yeah, we want to make sure that we're providing information across the board. Not everybody consumes information the same, so we want to give everybody access to different ways to receive this information. And we also want to provide them with a place to meet and connect with people that are nurses, certified educators, certified coaches that can help assist them through this process, because as you and I both know, it's not as simple as just walking into the dispensary and picking up a product and utilizing. It's understanding your ECS because it's individual to you. And so we're partnering with doctors, we're partnering with nurses and certified educators and coaches and people that are highly involved in the cannabis community to educate about this. So it's a diverse group of people coming together to provide this education.
Refresh me again. Where are you right now? Where do you stay? Where do you live?
I'm in Phoenix, Arizona.
That's right, Phoenix. And when you're saying is we a group in Phoenix that's helped you start this? Is that where you started from the ground level?
No, we're actually a collaboration from people around the world. So we're trying to make sure that one of the things, as I'm sure you're aware of, and most people are aware of, is that where you live determines a little bit how we approach cannabis or how we approach dealing with your health. And we think it should be a standard across the world, that we need to have some standardization about how we approach this for health, because it really does make an important improvement in people's health.
Right. No, it is very different. I've spoken to people in Europe. It's CBD, cannabis is dealt with much differently there. It's a lot of countries it goes through the doctor and prescriptions, and you get it actually at the pharmacy, and health insurances sometimes cover it. Here is a lot different. So a lot different.
It's very different. And the thing we also find is the education that each country is giving to their providers to do this is very different. And I think it needs to be standardized across the board.
Sure. So in terms of how did you reach out to people outside of the United States to be involved with this?
We're constantly doing broadcasts through social media. We have an Instagram page. We have Facebook. We have our newsletter landing page, which is effectivenewsletter.com to sign up to be in the newsletter. It's free to anybody that signs up and subscribes.
So it's just search effectivenewsletter.com and you'll search and find it.
Correct.
All right, good. That's good to know. In terms of like the social media, do you just have to search effective cannabis and you'll find it?
It's effective newsletter.com, I do believe. Hang on. Sorry about that.
For the other social media avenues, in terms of like Instagram and Facebook and.
We're mostly using Instagram right now and LinkedIn for this.
Okay.
We just haven't ventured out. We'd like to stay focused in one area so people know where to reach out to us. So
I totally understand, because when you're trying to do social media, there's so many different avenues. It gets difficult to be good at all of them.
it's hard to be good at all of them unless you have a massive team. And we are a team of people that are collaborating together, but we are all doing other jobs besides just this newsletter.
Right. So you've published one newsletter, I think, or is this the second one you sent me? So this is
that was the first one.
This is the first one in January, January 2023. Is it a monthly newsletter? Or is it something that happens quarterly?
It comes out every second Monday of the month.
Oh, wow.
And so, and each month we have a big broad umbrella of what we're going to talk about. So we just published our second one on the 13th of February, which was healthy lungs. And we dove into research and understanding. We dove into vaping and understanding the benefits of vaping into your lungs, not smoking. And then we have personal stories. That's the other part that's really nice about the newsletter is we have actual personal stories, anecdotal evidence of what's working and what's people are accomplishing with their health.
And that's a good point. A lot of right now is anecdotal. We don't have great studies just yet, but it's nice to hear about what other people are doing and how they're doing it safely. But in time, I think that's going to all change.
We hope so. This is how we do this, though. There's, we have a real problem about being able to talk about cannabis on social media and share what we want to, and without being shut down. And that's one of the, this is the reason the news, it is crazy. And this is the reason the newsletter came about.
Right.
It's because I was really frustrated with not being able to just talk about cannabis freely and openly, because I don't sell anything. I educate and try to inform you how to take care of your health. I'm an advocate for everybody's health. And the newsletter, you can sign up for it and you will always get it. You don't have to worry about the account being shut down and losing that access.
No, I know the last time we talked, you did personal health and wellness therapy, and that's what you really want to do. Doing this newsletter, I think you're going to get truly really busy because people are going to want to access your information personally. I'm sure that's making you so busy. I don't know how you have time for this newsletter.
It's really hard, but the really cool thing about the newsletter, in every newsletter, there's a directory of cannabis coaches, educators, and medical professionals that you can reach out to that specialize maybe in an area of health where you want to focus. There isn't one person, I don't think, that can take on every area of health when it comes to being qualified and helping a person with their health, because there's just so much to learn and to take in that, connecting with the right coach, educator, or physician or nurse to help you with your journey and understanding what you need to go through is really important. And so we provide that in every newsletter.
That's great. So at the least, if you got onto effectivenewsletter.com, there's a directory. You can find somebody close in your area to help with your personal need for cannabis or CBD. So at the least, that's really nice that there's a directory to help people in different parts of the country or the world in the future.
Correct. And we have people that do virtual and work with people across the board. They don't have to be close in proximity to work with you.
Right.
I think the
Right.
biggest key is, connecting with the coach or educator or medical professional that really can hone in on what medical conditions you're looking to improve.
That's how many people do you think you have involved so far? Because it's going to get bigger, I'm sure.
Involved in what way?
In
You
terms
mean
of as the directory and people that if you went onto this website or get on the newsletter, do you think you have people throughout the whole country? Dozens of people, or I don't know how did you recruit all these people? That's what's amazing.
Well, I went through some training through Cannabis Coaching Institute to become a certified educator on top of already being a certified coach.
Right.
And there was a very lovely community of people there that wanted to participate in this project with me. And so they've come from there. I've done outreach through LinkedIn and other places to connect with people and ask them to be involved. There's also the Cannabis Nursing Network, which is a good place that provides, medical professionals that can work with you. So we're just beginning to grow, and we're just beginning to grow this list, but you could find a good, probably 30 coaches right now.
Already, that's great.
On our list, and that's going to continue to grow as we
amazing.
Move forward.
Because I only talked to you a couple of months ago and you had mentioned this, and I cannot believe you've done this in, just in a short period of time. That's amazing.
Well,
this is going to get really big, I'm telling you.
Well, that's what our goal is, and that's our hope, because everybody needs to understand their health is important and they need to be in charge of it, but they also need to be able to work with a professional and understand how to do it. I don't want anybody to have to go through what I went through to learn.
Right.
Because, having a medical background is great, but there's so much to take in and understand. You have to understand yourself and get real with yourself, and make a commitment to yourself, but then to understand what cannabinoid therapies actually work for you is it shouldn't be this hard for people to figure that out.
Right. It's amazing. I'm so happy for you, because I've only read through what you sent me on the email, but I didn't realize there was an internet access to it, which I definitely want to sign up on. So I can keep up.
If you sign up for the newsletter, it will just automatically populate to your email every month.
Right?
Yep. And as soon as you sign up, you'll get access to the Inner Healer Guide, which is a guide that I wrote just to kind of give people an overview of why you even want to consider this.
Right.
And why your ECS or your endocannabinoid system is so important in your health.
Right.
I think that's the one thing that's missing the most for all of us, is that even as you and I went through medical training, we didn't learn about an endocannabinoid system.
Right.
And
that's right. That's absolutely right.
Learning how to accept it, enjoy it, engage it is something that's really important, and it matters for everyone, healthy or not.
So this is how easy it is. I just signed up right now. So
Great.
Simple. Just go to effectivenewsletter.com and in the sign up, just your name and an email, and it doesn't cost anything.
Right. It's free to readers and subscribers.
So the first newsletter that you had was on chronic pain. The second one is about pulmonary issues. So, these are great topics for people to understand with the use of either vapes or with cannabis or CBD, and it works well. And this is great. I'm gonna have to go through it. That was too easy. I should have done this the last time you sent it to me. It's already signed up.
Great. We're so happy to have you. And if you have articles or information that you would like to contribute at some point, we would love to have your voice included.
Right. Sure. Definitely.
So
you are really an advocate for people being involved and giving good information. I'm sure you go through it before you say this is good or bad. I'm sure.
We have a whole we have a whole review committee that everything goes through. We have a committee of 3, and then we have a guest editor every month that's got knowledge on that topic.
Right.
So like this next month is called Healthy Brain. And so we're going to be diving into the benefits of using cannabis for things like PTSD, Alzheimer's, CTEs, things like that. So we like to find someone that's got experience with that so that they can help also go through the editing process. But everything is vetted. We check all the resources, make sure there are resources that you can verify that this is really based on some form of information or facts.
I'm definitely going to put this on our website for people, for more, if they want to learn more, contact with somebody in terms of like a wellness coach. Even like you said, just listening to webinars, like the more information, the better. This is amazing. I cannot wait to see what happens in a year, because I'm sure this is going to blossom, because this is what people need and want. And people want to, and there's going to be so many people that want to contribute to it, that have their experience with cannabis.
And we don't own the information that's contributed with us. That's the other cool thing. We just want to share it. Right. So you own it, you keep it. It could be something you've published somewhere else, but we're reaching an audience that you might not have been able to reach, because these are people from around the world that are signing up to receive this information.
Yeah, that's great. That's great. I wish more people did this. It's still like you said, I went to medical school in the 90s. They didn't talk about marijuana much, very little. They didn't talk about the endocannabinoid system. I'm still learning about it. I've been involved for about a decade, and it is interesting to see what we're learning about it. And it has a role in our medical therapy.
Oh, definitely. I don't know how we're really taking care of someone's health, especially when they're not healthy, if we're not taking into consideration their ECS, because it is, I consider it the master guide over all of us, and taking care of everything that's happening, because it sends all the signals that we need to our organs and to our pain and to everything, the functions in our system, so that they work properly. And if it's out of harmony, then it's not working well for you, and you have the ability to take care of some of that if you re-engage with it.
Right. So you must spend a lot of time on this every month, getting the next newsletter ready. Is that true?
That's very true. Pretty much every single day is spent working on finding content that is quality content.
Right.
There's a difference between content and quality content. And we want to make sure whatever we're putting out is content that is definitely something that could help someone make a good decision for themselves, or even take it into their doctor's office. We would love to see people take the newsletter into their doctor's office and say, have you seen this? Have you read this? Because this is stuff that they can use as well. And we need to start educating doctors on how to utilize the ECS.
It's very true. Very, very true. That's why how I got involved 10 years ago with medical marijuana is because doctors were not, up on what it meant to have a license, how to use it. And I fell backwards into it by a patient that needed help. I knew nothing. And in time, I was learning with the patients. And I'm happy that I did, because it's nice to at least speak about it with patients in an understanding way and give them some education. But most doctors don't want to have anything to do with it at this point still, even though most states have, some type of law with medical use of marijuana. So it's unbelievable. But
well, and I understand the difficulty it is for a medical professional, because your license are on the line. And so being able to talk freely about it is not necessarily something that doctors feel that comfortable with, maybe, or nurses. I think we're making progress, but I think this newsletter is a place. This is a newsletter is a place where we can open that up more by doctors and nurses and all of us that are working together to educate this. I would love to see doctors and certified coaches in cannabis working together with patients and helping the doctors learn and helping the coach learn, because, to set up an appointment with a doctor and have the amount of time with him that or her that you need to do and understand how to start this process is very costly, and it's not covered through insurance. So
that's right. That is absolutely right. I do some education for medical marijuana licensing in Rhode Island, and the insurance doesn't cover it. But what we do is we give them as much time as they want. That's the nice thing, to help them understand not only how to get the license, but what to look for strains and different ways of using it safely. So You're right about that. I mean, you need time. When you go to see your doctor for that 15-minute appointment, you need more than that to discuss something that patients really don't understand. It's easy to say, hey, take this medication if it's a pill or a prescription for blood pressure. But with cannabis, it isn't really standardized yet as, like easy for a doctor to say this is the prescription to do. It's this, like so many different strains, so different hybrids that help different people. A lot of it is trial and error. That's what I tell patients.
Well, and you have different amount of receptors in your body each
Right.
day. So how it's going to respond
True.
one day may be very different the next day. And it's learning to get to know yourself and getting to know your ECS, which
Right.
is a big process that you have to go through.
Right.
And that's where a coach can come in and help you learn how to do that and sit down with that. But, basic information is what you need to just get started in understanding. And I hope with each newsletter, as we take these big umbrellas and talk about all these things, people will realize, oh, I didn't realize you could use that for traumatic brain injury.
Right.
Or, I didn't know that you could use that for migraines, like we covered in the pain issue.
Right.
No one would ever think you could use it to improve your lungs with COPD and MAC lung disease, which I've done. So, realizing that there are things you can do yourself by learning about your endocannabinoid system and engaging it can really make a difference, because I've actually made health improvements that no doctor could provide me for over 3 decades.
You told me that in the last time we spoke. Now you just got my interest in something. You talked about ECS receptors are different in certain days. Is it because of the weather? Is it because of your state of mental health? That's really an interesting concept. I'd never really heard somebody say, but it does make sense.
That's something, this is one of the places where we need to grow and expand and learn. And we don't really have the answer for that I'm aware of fully right now. I would love to see that we develop a test, just like you go into the lab and get blood work done,
right,
to establish how many receptors do you have,
right,
and what happens to them. And I do believe those tests are possible, being a medical technologist and working in a lab and understanding that. But it takes a lot of money to put that forth, and I haven't found anyone yet that is interested in partnering and trying to make that happen. But that's something that I believe is possible, and I believe will happen in the future.
But you need those receptors for this to work. And if we knew when our receptors maybe are more active than other times in certain parts of the day, or whatever it might be that affects it, you'd have a better response to your treatment. I have a patient that she just knows when she needs it, and she doesn't take this is just CBD. She doesn't take it every day. She just knows when she needs it, and when she takes it, it works great. It's not every single day. It's those days she just doesn't feel right. I don't know if the receptors need a boost, and then she takes it and it works wonderful.
And I can't speak from a person that's healthy. I can only speak from a person that's unhealthy, because that's where I live. But as an unhealthy person living with chronic pain, with arthritis, with lung disease, I need to medicate daily to keep that inflammation down so that my body is functioning properly, or at the best that it's possible. I don't strive to live a long life. I strive to live the very best life possible as long as I'm here. And engaging my ECS has made that possible. And so I think that, consistency is the most important thing, but it's not like if you've ever taken opiates, you look at the clock. You're always waiting to see when is the next time I can take a pill, because of the way it reacts with your receptors is different than the way that cannabis reacts with your receptors for me. And so, I don't ever look at the clock anymore. I just have a built-in routine. Wonderful. I just feel great. Being able to be in charge and not have to say, oh, I can only do it every so many hours, is not a good, healthy place for someone to be when they're trying to improve their health. So with introducing cannabinoid therapies, you get to decide when is it okay to medicate and take more because I'm having a rougher day today than I did yesterday. And that's such a free and liberating experience in your health journey, and being able to do that.
what's nice about, what you're doing is because it's helped you so much, you just want to collaborate with anybody you can to understand this and do this as another option to help your health. Like you said, we don't want to live a long life. We want to live a really healthy, functional life. That's the goal.
Correct. Well, it gets frustrating for me when I go into my doctor's office and they see all the improvements that I've made. And I know they're walking into the room next door and not telling that person the accomplishments that I've achieved because they're too afraid to bring it up and talk about it. And that's where, when people start hearing these stories and reading these stories and getting familiar and seeing a consistent pattern, because we see it, you and I see it, consistent patterns of people making improvement in their health. But how many times have you heard, well, I heard someone say they took care of their pain, but then when did you hear about it again? So, being able to pull it together and put it in a place where you have multiple people talking about it and sharing the information, I think is really critical.
Right. No, I think seeing other success stories, having people talk about and educated, then you feel more comfortable using this. Sometimes just hearing one story isn't enough. You have to hear more than that.
Right.
To say that, it's just not a coincidence or but I always say, one's an accident, two's a coincidence, but if you hear three people, it's a trend. And so that's why the more you hear, the better. And I think, and I love this. I'm going to go through this now that I signed up. Now I'm going to start looking through it. But I think this is a great idea. Now, if I wanted to collaborate, how do I know what the topic is, like for next month if you needed information?
Once you sign up, I think we give you a list. I'll have to double check this to be honest. But if you want to collaborate, I'm always available. But we do keep a rolling calendar.
You do.
So that we're already out through May knowing what our topics are going to be.
Okay.
And then we'll be broadcasting the other topics coming real soon for June, July, and August, because we know the summer months are the hardest months to get people involved in providing content. So we want to get that out there now. And we do have what's called the ECN Advocate, which is a tool that we created for the professionals that want to be involved in this, to give them access to be able to be a contributor to all of this and add content. So that's a whole nother piece that we built in to try to make it so that you don't get shut down, but how to work with social media and things like that. So, but we have a submission form that you can just submit your content.
Debbie, I'm very impressed. You're very organized. I'm telling you, this is going to be like wildfire. People are going to hear about it. They're going to be involved. They're going to want to listen, learn, and then the people that know information will want to get involved and collaborate. So I know we talked about this. I can't believe you've done this much since the last couple of months we talked ago, a while ago. Amazing.
Well, we've been working on it for a while. Like I said, it's not something that just came up overnight. We've been actually working on it since last July. So, but yeah, to get all this put together and have all these pieces in place, I never could have imagined when I had this dream and this thought that it would be where it is today. And it is truly amazing to see the reception that we're getting with it. It's really good.
Yeah, like I said, I'm going to put it on my website too, just for people that want to find more information, talk to other people, see some, other people seeing the success of this cannabis treatment. This is great. All right, Debbie, great talking to you. Congratulations on this endeavor. I'll be watching. Hopefully I can collaborate. I'd love to see what I can help with as well.
Well, I would love to have you come and do some pieces on your senior care that you do and your hospice care that you do. I think that's really important what you do there. And I can't stress enough how we need more doctors involved. And I truly appreciate that you do take the time to learn and share.
I appreciate that. All right, Debbie, we'll stay in contact. I'll send you the link when I get the podcast. I'll do it this week. I'll send it to you. And then
great.
Now that it's so easy I just signed up while we were talking. I didn't realize it was that easy.
It's simple. We want to make it easy and not hard for people to find their information.
All right. Great talking. I will keep in contact. Nice talking to you, Debbie.
Okay,
Thanks
sounds
for the
great.
time.
Thank you very much. Have
You're
a good day.
welcome. You too.
Okay,
Bye.
bye.